All right. Hello, everyone. My name is Craig Struble, and I'm a consultant at CERC. Welcome to the series entitled Supporting Your Child's Health and Well-Being During the School Year, brought to you by the Connecticut State Department of Education. Tonight is part one, Supporting Your Child and Family Wellness. Before we get started, I'd like to go over a few of our Zoom features. Many of them will be familiar to you, but some of them might be new. The first feature is sign language interpretation. We have Kellyanne with us today providing ASL interpretation. Right now you see her in the main view, but once I start the translation on my end, she will disappear from view. And you will see this notification pop up letting you know that sign language interpretation is available. If you would like sign language interpretation, select the interpretation button on your toolbar. If you do not see this button, you may need to select more on your toolbar. After selecting the interpretation button, a menu will pop up. And then simply select American Sign Language. And then you will get a pop-up window with the American Sign Language interpreter in it. The next feature is closed captions and caption translation. If you would like the captions on, select the Show Captions button on your toolbar. If you would like to change the language of the caption, select the small arrow on the upper right corner of the button. When that menu appears, toggle Translation on, and then choose your speaking language and your caption language. Next, we have the chat button. Please use it for sharing information, providing reactions, or also mentioning if you have any technical difficulties, and we'll be monitoring the chat so we can help you out. However, please do not use the chat for any questions that you have for our presenter, because sometimes those can get lost in the mix there. Instead, we have the Q&A button for that. When you select this button, a window will pop up, and you can use it to ask our presenter content-related questions. And if you see that you have the same question as someone, you can give it a thumbs up, and that will upvote it. Finally, we have the React button. Select this button to use emojis to show your reactions throughout the presentation. And that is it for the Zoom features. So now to get us started with introductions, I'd like to hand it off to John Frassinelli, Division Director of School Health, Child Nutrition, and Family Services.
Thank you, Craig. And thank you to CERC for helping us with this webinar tonight. And thanks to all of you for joining us for this opportunity. Again, this is the first in a series. We're going to continue to have these as long as there is interest. So please, at the end of this, you'll see the next two opportunities to join us for some important conversations as well. With that, it's my distinct pleasure to introduce you to Charlene Russell Tucker, the Commissioner of the Connecticut State Department of Education. Commissioner.
Thank you so much, John, for your kind introduction. And good afternoon and welcome, everyone, to this first of the three-part series that we have, Virtual House Calls for Parents, Caregivers, and Families. We're going back to the days, yes, we know, we're calling, the doctor is in and coming to your house. That's what we're doing virtually this evening. And the theme, as you've heard before, is supporting your child's health and well-being during the school year. And today we're focusing on supporting child and family wellness. This is something that is so important to us at the Department of Education that we wanted to come to you directly to provide you this information as you continue to work with your students, your children during the school year. This theme is directly linked to another focus area that the department has, and that's one of them is strengthening partnership with families and communities to promote high impact practices that make a difference for all their students, all their educators, and for all their families. So we're really pleased this evening to have Dr. Ketter join us with department staff and our State Education Resource Center and all of you in attendance. It shows it's taken a team of us to work together to make sure that you are supported. So again, appreciation to Dr. Ketter, who you will hear from, and he will be introduced to you. But thank you, Dr. Ketter, for joining us again to talk to our families. And I want to thank my colleague here from the Department of Education. We have John Fresnelli, who you just met. You'll also be meeting Amanda Pickett. Cloanne Bobrowski is here as well. And I'm thanking CERC under the leadership of Ingrid Kennedy and all the CERC staff who are making this event possible. So when we talk about our theme this year in education, and you'll see a screen with that information on it when you came in, it's a universe of opportunities. And really, this is what I mean, that there are opportunities not just for our students and not just for our school staff, but also opportunities for you, families, caregivers, with all our students across the state. That is to make sure that they're supported, and they can thrive. So thank you again for joining us this evening. Know that we'll continue to do these, as John mentioned, as long as they're interested. And do me one favor. After participating this evening, your job is to share what you've learned here, but also to let your friends and family know that these opportunities will be made available. I know that we'll find ways to stay connected with you after this evening, but again, my appreciation and thanks for taking the time out of your schedule to join us so we can work together in supporting you, supporting your children, and in turn supporting our entire education system in the state of Connecticut. So thank you and enjoy your time with the doctor. The doctor is in. I'll turn this back to John.
Thank you, Commissioner. Thank you for joining us tonight. And thank you, as always, for your unwavering support for our work with families and the importance of families in the entire education system. I will turn it to Amanda Pickett, who will introduce our guest presenter.
Thank you so much. I couldn't be more excited and honored to get to introduce Dr. Robert D. Ketter. Dr. Ketter is a physician specializing in developmental behavioral pediatrics, which I know he's going to explain more about that. His areas of expertise include autism spectrum disorder and developmental delays. He is the core faculty leader and rotation director for developmental behavioral pediatrics, an assistant professor for UConn School of Medicine, and has contributed to countless publications. But more than any professional distinguishment, Dr. Ketter is an incredibly kind human who wants what is best for kids. So without further ado, please welcome Dr. Ketter. Please make sure you unmute first, Dr. Ketter.
Oh, thank you. I will unmute because, we learned Zoom once upon a time. But I was just so flattered by your introduction that I forgot to unmute. So thank you so much. And I hope that I'm able to live up to your expectations. But welcome to everyone tonight. Thank you all for having me. I'm super excited to be here with all of you. So let me just invite my slides to join us up here on stage. So again, my name is Rob Ketter, and I am one of your friendly neighborhood developmental and behavioral pediatricians. We're here tonight to talk about growing resilient together, how we can support child and family wellness together. So to do that, first, I just want to get to some of the nitty-gritty of things like disclosures. So a couple of points of order first. All right, hold on. Just one moment, because my slides, which were working one moment ago, froze. All right, here we go. Thank you everyone for bearing with me as my computer just decided to get so excited that it wanted to start all over again. But I don't have any financial conflicts of interest. I'm here just as a neighbor in the neighborhood of Connecticut. We're not going to be discussing anything like medications or anything off-label. As a physician, I try to help make sure that all of my patients and families I work with have access to evidence-based tools. However, I just want everyone to know that what I'm talking through tonight is not intended as specific medical advice that's tailored to your child. If you have any specific concerns that come up, please consult with your child's teachers, providers, primary care provider as needed. I am a volunteer board member of the Connecticut Family Support Network. I also am a special education consultant for one school district here in Connecticut. Any of the images that I'm using are freely licensed from Unsplash or Canva or AI generated with a subscription to Midjourney, or they're part of our own Connecticut Children's Image Library. I'm also the medical director for our Hartford Area Medical Legal Partnership with the Center for Children's Advocacy. And just as a point of order, as we invite you to share questions or thoughts through the Q&A feature, please don't share specific personal information in the questions or the chat. You deserve your privacy. So if you want to speak about a child in general, please just try not to use a child's name or something like that. Getting to know me, for those of you that don't know me, these are now my personal disclosures. That's me. I'm a total geek. Be prepared. I'm going to get excited and a little silly. You're going to see how I approach the work of developmental and behavioral pediatrics with a background in ecology and evolutionary biology, as well as developmental psychology. So that means that I think through a lot of things from the big picture, which is how are systems, how are things connected, how does a butterfly flap its wings, and how does that turn into a tornado? Because it's all a little connected. Personally, I identify as an able-bodied, white, bicultural, second-generation Cuban-American male. So buenas tardes to everyone here. Super happy to be here. And I personally use the pronouns he, him. For anyone where I also admit that this picture of me is depicting me being a total geek and a character that I love, but for anyone that means anything, I appreciate the art. I disagree with the artist. All are welcome here, and we all need to learn to grow together. So that's why we're here doing this. And as someone, I do disclose that I sometimes mispronounce things in English and even more so in Spanish. I grant anyone here permission to teach me how to pronounce something appropriately as an adult who took speech and language therapy as a child, but please don't generalize that behavior to everyone. Also, because people ask all the time, I am a certified Funkle trademark. I have the sign given to me by my sister. I'm also a parent ally. So when I work in this field, I'm approaching this as not something that I take home every day, but something that I live with every day vicariously through my patients and families, and also bring a sense of clinical expertise. Now, many of you might be asking, who or what is a developmental and behavioral pediatrician? Developmental and behavioral pediatrics is a specific board-certified subspecialty within pediatrics. So what does that mean? It means that I went to a lot of school and training. I did 4 years of undergrad in college, then I did 4 years in medical school, then I did a 3-year pediatric residency, and then after that 3-year pediatric residency, I did a 3-year fellowship specifically focusing on training and working with and supporting children and families with disabilities. I also did a 1-year LEN fellowship, that stands for Leadership Education and Neurodevelopmental Disabilities, through the University of Massachusetts Shriver Center. So developmental and behavioral pediatricians do a lot of things. We are Jack and Jills of many trades, but what we really do is specialize in diagnosing and supporting children with all kinds of disabilities, including autism, ADHD, anxiety, learning disabilities, intellectual disabilities, and behavior problems. And if you see a doctor like a cardiologist or a pulmonologist, they get very focused on like what their specific organ is, like the heart or the lungs. But as a developmental pediatrician, my focus is on life course. So that's kind of where I'm focused on how do we meet kids and support them so that they can be their best self 5, 10, 20 years from now. And we want to think using that proactive way of how can we lay the groundwork for all kids to be successful, reach the best of their potential and privilege, while also using the framework of being anti-ableist, meaning we want to support them to be their best self, period. So also some acknowledgements. So this is the tail end of Hispanic Heritage Month. And again, as I identify as second-generation Cuban American, I was just at a conference in Florida and I got to have croquetas, which is like the world's best food if you identify as Cuban. I also want to acknowledge and celebrate that it is Yom Kippur this weekend. So for all of you celebrating that. And then at the end of this month, we also have upcoming Diwali. And really, part of the reason that I start bringing in these celebrations is because this actually connects to what we talk about tonight. When we think about resilience, we have to acknowledge all the things that come along and in the background. And in this way, we have a lot of positives. We have a lot of holidays and opportunities that bring routine and protection and some nice opportunities. However, I also put a set of scales here because acknowledgements also include the fact that there's a lot of other stuff going on right now. There's a lot of problems in the sense that we've had 2 hurricanes and we have people recovering from 2 hurricanes. We have wars going on across multiple continents. We have people who are experiencing refugee status. We have people here at home who are experiencing problems related to homelessness and trauma. So it's hard to not acknowledge that all of that is what's kind of carried in with us. And part of what we want to do is just bring that mindful level of awareness so that we can help package it as we think about how do we go through our goal tonight, which is resilience. So first, let's talk a little bit about what the word resilience means and its basics and how we can help you support you and your child together. So resilience is a fancy term, but what it means is how you and your child can bounce back from stress and adversity. The world itself is very stressful. Some stress can be good. It helps us grow. But too much stress, especially when that stress is without protective supports, is something we call toxic stress. And that's really, really bad. When we have kids or adults experience things like trauma at home or neglect or have a hard time dealing with transitions, because we all have things. I think ultimately we go through all these hard times, but what's most important is how do we balance out those toxic stress and how do we help provide all the positive resilience factors to support our kids? Well, here's the most important thing. Like if you take one thing away from this talk for how do we help kids be resilient, research consistently shows there are many keys to resilience, but there's one. TLDR, which means too long didn't read. For those of you who are not hip with the young kid lingo, I'm still working on it. And if anybody understands what the sigma means, please let me know. But I'm not convinced any 8-year-old actually knows what the sigma means either. So it's just kind of like a big conspiracy. But anyway, the TLDR is research shows the single most important resilience factor is having safe, stable, nurturing relationships. And this is what we get from time and time again, looking at research from seeing children across various studies of psychology to also seeing how infant rats and rat mothers connect with each other. But what's most important is that when you have one adult who's there to be your safe, stable person that you can connect back to, who's going to help support you over time, consistently, that's what makes the best outcomes. Doesn't matter your genetics. Doesn't matter what you've got going on your plate. If you've got at least that one positive, safe, stable, nurturing person, that's helpful. The reality of that is, though, is that we're all people and we're human beings. So like, we run on empty, we get tired, and those are parts of the reality of this. So what's really funny is you're going to notice that as I talk about how we're going to be helping kids be resilient, fun fact and surprise is all those same things that work for kids work for us too as caregivers. And this is where it's kind of like a chicken and an egg thing where it all comes together. So we just want to keep that in mind. So some of the things to think through and think about. There are a lot of keys. Like I said, those stable, safe, stable, nurturing relationships are the core thing. So connection is one of the best keys to building resilience. But we have a lot of other tools too. Routines are really important for kids. Routines provide a sense of safety, control, and predictability. When we think about what creates anxiety for everyone is when we lose a sense of control and predictability. When we teach kids that there is a certain routine, even if it's something as small as like we read the same story before bed and the child's like, that's not how that story goes. Like it's this way, right? They're starting to show mastery over the world because they can predict what's going to happen. And then that feels good. That gives them a sense of perceived control. When we use those same routines for them, like bedtime routine or coming home after school routines, those are really important and helpful. We also need to focus on self-care. And here's the hard thing. Self-care needs to be modeled and taught. You know, we've all talked about how since COVID and the pandemic, we've experienced a lot more stress. What that really highlights is what we're not talking about, which is how do we focus on training and teaching each other that, like, one, we can acknowledge that we're human beings who feel tired and stressed sometimes, and two, that we actually need to like show kids like how to deal with stress, and we want to teach them how to do that. And we'll talk a little bit about that in a bit. Self-efficacy is something very important. Self-efficacy is different than self-esteem. Self-esteem is how you feel about yourself. Self-efficacy is your feeling of, I can do this. We as adults have to support kids in building this ability. This will then support the development of their self-esteem. But if you or a child don't have a sense of, I can do this, it's going to be really hard to develop that positive sense of self or self-esteem that we need later on. And that's where we have to remember that kids are kids. They don't know things. So we have to train them from the ground up. We'll talk about that. Traditions are so important. Family traditions give kids that sense of connection and stability that they crave, even during uncertain times. These traditions can be a foundation of hope and reassurance, whether it be what you do around the holidays as a tradition, or that you turn Tuesday into taco night or Friday into pizza night, or that Sundays you maybe take the afternoon and go out for a walk to the park together if the weather's nice. Those traditions are really important. They give kids that sense of stability that they really do crave. And yeah, I know all of you who are parents of teenagers are like, but that's where they also roll their eyes and do things. Yes, they do that because they're trying to experience like what it's like being cool and like, I'm too cool for this. But when you take it away, they secretly miss it. And it still gives them that sense and opportunity of like, okay, I know that this is coming, so we can get through this together. Something that the conversation is turning to now as we focus on the behavioral health crisis, although I would try to reframe from the term crisis, because kids have always had behavioral health needs. We're paying attention to it a lot more now. And as we pay attention to it a lot more now, it means that we need to give that sense of mindfulness. We want to help kids learn how to focus on the present moment, because when they can take that ability to stop and focus on what's going on, how am I feeling in this second, like what's going on, it will let them better manage stress and adapt to change. It's really hard because sometimes we have 20 million distractions. And I don't know, as a child of the 80s, I like to tell kids back in my day, because, you know, I am not really feeling old, but I'm kind of getting old. You know, back in my day, when our Game Boy ran out of batteries, that was it. Like you had to wait for a whole week until mom or dad went back to the store and you got 4 AA's again for your black and white, really clunky Game Boy. And you learned how to deal with boredom. You learned how to be creative. But the difference for childhood now is that we have so much access to things like electronics, which are not inherently bad, but we have so much access to things that the challenge is it's hard to be bored and it's hard to be mindful because we just have so many other things that crowd out those opportunities. So we want to think about that. Finally, one of the most important tools, play. Play is how kids learn, period. Stop. Play is critical. Play is fundamental to how all children learn, especially young children. It allows kids to make mistakes in a safe and comfortable environment, and it lets them develop problem-solving skills, right? Play is how we learn all things. How many of you have actually shown your 2, 3, 4-year-old how to use a tablet? No one, right? Everybody, like, I love it in clinic where parents are like, yeah, it's like he figured out how to do all these things. Well, he has no shame and he's curious, so he's playing, right? And that's how kids learn things. And then all of a sudden, that's where your things get programmed in different languages and password reset. And you're like, how do I do this? Now you've got to spend your time playing catch up, like literally playing catch up, right? So these are some of the things that we have to think about, but these are our tools. But part of these tools are that we have to focus on that resilience is something that's taught, built, and trained. It's not something that you just pull up or just do one day. Contrived resilience is not a thing, at least not in the space that I like to work in. And what we learn from research is resilience is both taught and trained. We need to give and teach children the tools to learn how to deal with all kinds of stress. There are so many different types of stress that we do want to just break them down and just acknowledge that there's not just one flavor of stress. There's emotional stress, physical stress, social stress, cognitive stress, right? Math problems might give you cognitive stress, spiritual stress, and financial stress, right? Now, financial stress as a kid is like, do I have enough money to buy the action figure that I'm looking for? And maybe for a teenager, it's like, oh man, they just came out with a nice new pair of Air Force Ones and I want them. How do I manage that? Right. But the reality is those small things add up to help us make better financial choices and learn how to deal with financial stress as we're older. So each of these are domains or areas that we can think about how we can teach kids how to handle these little buckets of stress. We also have to acknowledge not all kids learn the same. This is kind of like the secret joke, right? That until you're a parent and have your second kid, you're like, every child and every baby is the same. And then all of a sudden, child number 2 comes along and you're like, oh, wow, like this one's so different from that one. I just thought kids and babies were all the same. They're not, right? They're wired differently. We're all wired differently. And to be honest, life would be awfully boring if we were all exactly the same carbon copy thing. Then we'd be like sponges and, we wouldn't have like all the cool things that we have. So not all kids learn the same. So we have to acknowledge that. We also have to acknowledge that we can help kids build skills by scaffolding them through it. And that's why there's a picture of a building here with scaffolding on it. The term scaffolding means that we put up extra supports to help us as we're building a brand new building because it can't stand up on its own yet. But as we're trying to see, did we make a nice, secure, safe building? We slowly take off those scaffolds. And if the building stays upright on its own, we're like, yay, we're done. That's kind of like how training wheels work on a bicycle. But we have to stop and think that we can scaffold kids to learn how to deal with any of these types of stress, as long as we provide them the right training and expertise. That's what we refer to as this concept of a zone of proximal development. And we're going to come back to talk a little bit more about what that is. Okay, so quick break. We're now moving on to the next part. Resilience needs opportunities. This is what permits growth and repair. And here I'm going to use 2 different analogies to help us think about what are the things that we're seeing. So this is a core concept. As I mentioned, the zone of proximal development was developed by a developmental psychologist named Lev Vygotsky. And he was quoted as saying, what a child can do in cooperation today, they can do alone tomorrow. What this means is that process of scaffolding is so critical to how kids learn. Now, this little diagram is a bunch of concentric circles that look like a bullseye. The way that this works is kids grow outwards, kind of like the rings on a tree. We add on new layers every year. What we have in the middle is kind of what we call the comfort zone. That's what a child can already do. Like if we're like, hey buddy, can you give me a high five? They're like, boom, I know how to give you a high five. I can do that. But the next layer is what we call the zone of proximal development or the learning zone. This is what children can do with help and support. Right? So this is where we're training new skills. If we're thinking about something as basic as potty training or toilet training, right? We train these when a child already has an ability to do some things, like they can pull up their pants or they can pull down their diaper. They can go, ooh, I need to go, or they could sit on the toilet, or they could also maybe communicate that they need to go or go, you know what, I need to be changed. When we start seeing all of those signs, then we can help them put all of that together and go like, oh, you need to go potty? And then we bring them to the potty and we help reinforce that. That's the learning zone. But we have to be careful with kids, because if we go past this zone of proximal development, we get into what some of us refer to as the anxiety zone. This is where it's too much. And kids can't do it now. Even with support, they're like, This is what one of my colleagues who openly identifies as disabled will call the Mount Everest problem. she would say, you could offer me $1 million to climb Mount Everest, but it's just not going to happen. So like, it's not going to happen. So we have to be realistic about where we meet kids. The reason that we call this the anxiety zone is because if we start pushing kids and demanding kids to do things that's outside of their zone of proximal development, that's where we start getting emotions, anxiety, anger, irritability. So we want to be thoughtful about where we meet kids and what we expect of them so that we can support them through all of these things. Because if we ask them to do something outside of their zone of proximal development, that's not on them, that's on us as the adults. Okay, so why do we need to know these things? Because we're human, right? Like, if there's any parent here who's never, ever, or teacher who's never, ever pushed a child a little too hard past their zone of proximal development into the anxiety zone, like, feel free to like say hi, and I'll find a check for you, because I've never been able to do that, right? We're all human. And by being human, it means sometimes we go, oops, that was a little bit too much, right? And that could be something as small as like, you know what? Thanks for the invitation to the barbecue or picnic, but little Johnny's just having a day. We'll call you. We're going to bail, right? Because sometimes we just figure, we thought that was an okay thing to do, but maybe our child's not ready for it yet. So we use these repair strategies. But even when we aim in that zone of proximal development, we need to offer those opportunities for repair. Now, part of the reason that I do this is introduce this. So kintsugi is something from Japan. It literally means to join with gold. And this is a Japanese art of repairing broken objects such as pottery or glass with gold or silver powder. And here, I don't know if it's showing up on camera, I'm holding the bowl that's in the picture here. This is a bowl that was shattered and is joined together with a little bit of gold here. This is a cultural art that's based on the idea that we can embrace imperfections to make a piece of art stronger and a lot more beautiful, right? As parents, sometimes we panic and get a little anxious when our kids have to experience stress. But we need a little bit of that stress to make the art, and we need a little bit of that stress for growth. What this really does, though, is it highlights that the repair is important. We don't want to hide it. We want to understand that breaking and repairing is part of who we are and where we come from. So this also tells us that even when we experience like real stress or real trauma, we can grow and come past it. We can develop tools and skills to come back together and be stronger. And that's in part what we refer to as resilience. It's also a metaphor for healing, right? The gold seals the cracks and it becomes a golden scar. It represents the impact of life events on our lives. And, some people would suggest that the gold symbolizes strength, uniqueness, beauty, and our own ability to heal. And I think that that's really important because as we think about stress and trauma, this is one way to look at it. Now, I said I'd provide another analogy, and that's another one that's really easy. Let's just think about weight training, right? Like, how do we help build a muscle? Like, if anybody here likes to work with a personal trainer or, you want to do something, we have to think about how much are we lifting? So like, say you ask a child to go pick up something that's 20 pounds and they're like, I can't do that. That would be in their anxiety zone. That weight is too much for them to do right now. But if we're like, can you lift 2 pounds? They're like, yeah, duh, I got this. I'm bored. I can't like do anything with it. But if they're like, let's see, can you lift 5 pounds? And they're like, yeah, this is a little hard. But you're like, hey, buddy, you just lift 5 pounds. That was awesome. High five. And we offer that opportunity to congratulate on having done something that's difficult. But also, we want to step back and recognize that we just did have the child step up and do something that was hard. So we want to give them some time to come back together and repair that. And that's where we have to look at it, again, as a process of stress and opportunity for repair. We all need a little bit of struggle for growth. And this is where, like, I love it. My personal trainer will tell me, well, Rob, if it's not hard, then you're probably not doing anything, right? You come here for a little bit of a push, and that's what we want, a little bit of a push, right in that zone of proximal development. The key word here is little, right? Because if it's too much weight, we don't want to break anything, right? Kids are awesome and precious. We don't want to break them, but we do want to help them grow. So repair needs two things: rest and recovery. Rest is time. Recovery is the glue. And this is where you can be the gold. That's you. So you're like, how do I help my kid? This is where you can be there. You can be emotionally supportive for your child, right? If you have a child who's able to talk through like how they had a terrible day, remember that for them, that's a terrible day. And we'll talk about that perspective taking in a moment. But a lot of this is you already have these tools and skills and you do it. But the hard part is we're also juggling our own wellness as we're trying to do this too. So we want to pay attention, know your child. Resilience is not one size fits all. There's nuance to it, meaning there are micro details. Some children are more vulnerable and others are a little bit hardier. Neither is good or bad. The question is, who's your child? Kids have different temperaments. And I come back to that joke of it's hard to understand what temperament is until you have your second child, because baby number one, when baby two comes along, you're like, wow, they're so different. Like some babies are very chill, even as an infant. Some babies are a little bit more spirited or strong-willed or fussy, and some are a little bit more sensitive. But these are all patterns of strengths and weaknesses. I love it when families are like, but I wish I had a really easygoing toddler. Okay, I get that you want that. But again, each of these is a pattern of strengths and weaknesses. A toddler who's very chill and easygoing is possibly going to be very chill and easygoing throughout their life. So that's the child who, like, okay, as a toddler, you're like, yeah, you're cool. But sometimes when that kid's like in 8th grade and you're like, buddy, you're getting some C's and D's and not turning in all your assignments, what's up? And they're like, I'm cool with it. And all of a sudden, like, you start getting that eyebrow twitch and you're like, but I'm not. And they're like, but I'm cool with it. Right. So like those easygoing kids can be a little bit harder to motivate sometimes because they're just kind of like, yeah, I'm chill with what I like. On the flip side, you know, whenever parents get that really strong-willed, intense, fussy 4-year-old, it can be hard, but this is where I respectfully say, like, can you imagine respectfully what Ruth Bader Ginsburg was like as a toddler? Because I'm willing to bet that dissent is amazing when you are someone who has such stature, status, and is a wonderful historical figure and, you know, memorable person for us to look up to. But when you're a toddler, man, dissent is not cool, right? You're like, honey, we need to go, like, we need to get in the car now. I respect your dissent, but now is not the time. So we just want to recognize that all of these are patterns of strengths and weaknesses, and they are neither good or bad. We just want to pay attention to how our kids work so we know how to meet them where they are in that zone of proximal development. And this is where the research still shows that no matter what your temperament or genetic makeup is, when there are those stable, strong, nurturing relationships and adults presence, kids do great. So that's why you being there and showing up is still the most important thing. If you're like, I want to read more about this, there was a great book that came out a few years ago called The Orchid and the Dandelion: Why Some Children Struggle and How All Can Thrive. This was written by Dr. Thomas Boyce. Essentially, it helps us think about the modern framework of temperament, that some children are orchids and some are dandelions. Some kids are very beautiful, but very fragile, like an orchid, where you have to have the right temperature, the right amount of sunlight, the right pH level of the soil, the right amount of nutrients. And if one thing is off, boom, it's trouble. But if you do all the things right, like, wow, these are kids who, if they learn how to get out of their own way, are going to be awesome and stellar and probably president, attorneys, or CEOs at some point. But on the flip side, there are kids who are just sturdy, like dandelions, and they're like, okay, yeah, I'm good, right? And we all know the friend who's like so easygoing and chill that you're like, I'm having a day, and you're like, I just need my friend there because like they're awesome, right? And those chill, even, cool temperaments are great too. So all of these bring their strengths with them, and we just want to unlock that. We also want to pay attention because if you're like, oh, there was a major event that happened at school, or ooh, we're experiencing some family news, pay attention to which of your kids is the orchid and which of the kids is the dandelion, right? That will help you better triage or think through, like, how do I approach my kids and who might need a little bit more support to be fair and equitable amongst your own kids. If you have that easygoing child, remember, they might adapt to things more easily. right? But if you have that anxious or fussy child, they might need a little external support, some extra hugs, reassurance, and teaching, but they're still going to be able to develop that internal resilience if we show them how to do it. And that also means role modeling things. So this is where we're allowed to be human with kids and go like, honey, I'm in my yellow zone. I'm going to take a deep breath right now. Okay, I feel better. Let's talk about this. Or like, honey, I'm in my red zone and I don't want to say something I don't mean right now. So why don't we all take a 5-minute cool down and come back and talk? Because this way we can all chill out and come back to our green zone and talk to one another. Like, right? Wouldn't it be great if you had like a 4 or 5-year-old who's like, you know what, mom, dad, parent, I need to just take some time and chill. Like, can we come back and talk about that afterwards? Awesome, right? Because that's helping us develop that emotional self-regulation that's really critical to resilience. But we have to remember that regardless of all this, we can coach and support them to develop these skills. Now, again, this is not intended as personal medical advice, but if you are finding that your child is struggling with emotional regulation, or you're dealing with trauma that as a family is more than what most families go through, loss or grief, bereavement, divorce, separation, other things going on, it's okay to reach out for a professional and ask for help. If you're feeling that you're like, oh, this is so hard, can we get back to thinking through like how we get through all of this? You know, like how can I better support my kids? It's okay. We have professionals who exist to help support you through that. No stigma. This is about how we do better for all of us, and that means doing it together. Other things to think about that are really critical, the power of play and perspective taking. We have to remember that play is learning. Play is what helps build our growth together, both as kids and parents. Play is a great tool for building our relationships, right? Play lets us do all the things, and play lets us figure out how things work. Play lets us figure out how to deal with micro problems, like, right, what happens when our block tower falls down? That's our first lesson in the ephemeral nature of all things, right? What happens when that awesome bubble pops? Boom, it's gone. But wasn't that an awesome experience? And, you know, when we can learn to deal with the fact that our bubble popped or our tower fell over and we started again, then we can go to the next level. Things like board games, which are great ways to teach play skills, and also a great way to teach, like, you don't win all the time, and that's okay. But did you have fun? Yeah, that was fun. Oh, so and so won that time. Wasn't that cool? Right? We can also use play as an opportunity to experience things that are not as familiar yet. And that's why I love this picture of a child with a medical kit here, because it helps us think about how do we teach kids to encounter things that are not in their zone of proximal development yet, right? We're providing the opportunity to scaffold something new through play. Now, no opportunity is too small. We never want to gaslight a child for their feelings, right? Even something as like, look at how cute this image, like no rights, copyright image is, right? This kid's really cute, but they're struggling and we don't know what's going on. It could be that the sun is too much. It could be that that's not the birthday cake that they wanted. What we thought was a party and the intention was you're going to have the time of your life. The impact was I'm having a rough day. And, you know, when kids do this, this is one of my favorite things. I did some improv theater, and one of my favorite games is something called Oscar Winning Moment. But right, our goal is like, how do we help this child learn how to deal with this now? Because this is where, thank you, artificial intelligence, for letting me develop this image here. But right, our goal is how do we help our child not do this? Because now we went from, oh, that's cute, to like, why is that 30-year-old crying over a piece of cake at the beach? That like, right, our brain is triggered and we're thinking through things. But this is where each of those little opportunities is an opportunity to go, how do we learn to manage this? Because for that toddler, this is a big thing. And it seems like an Oscar-winning moment. It's such a fun improv game. If you do improv and like Oscar-winning moment, it's such a fun one. But like, right, where all of a sudden we're like, okay, we're having cake and you're sad. Let's take it to the next level, right? But for this child who otherwise doesn't know the challenges of the world yet, this is an Oscar-winning moment because that's the biggest struggle they've encountered yet. And it means that you've been doing a great job of helping them deal with encountering the world step by step by step. So how do we help them learn how to deal so that we can change this picture and not have them walk on that trajectory of like, right, I'm going to be a 30-something-year-old and deal with struggle for the first time, and it's going to be rough. Every kid has an Oscar-winning moment, and some of you may have children that seem to have several Oscar-winning moments in a day, right? You're like, thank you, honey, for trying to be Sally Fields, or thank you for prepping for the next telenovela that's going to air. But like, how can we take the drama and dial it down a little bit? But each one of these is an opportunity to practice our growth and repair strategies. How do we work together to support them? And this is really where I invite all of us to stop, because I know we're tired, especially when kids get really stressed. It pulls us out of our green zone into our red zone, and we get in that place. But if we can pause and remember, what's our future investment? Because, right, if we can help all of our kids learn to deal with the little stressors, then they can deal with the big stressors later on. And here I'm not talking about like not getting the cake that you wanted or being uncomfortable on your birthday. I'm talking about how can we learn to deal with the stress of not getting what you wanted at the store, and then learning how to deal with the fact that you're going to have a credit score later on in life, or maybe not getting picked for the baseball team, because that is a big stress for a child. But if you learn how to deal with that and develop the coping skills to just think through it and meet them where they are, that's going to help them learn how to deal with a relationship breakup in the future, or maybe not getting the job that they wanted, and help them recognize that you can apply and do it again. We do want to remember that we have to meet kids where they are and take their perspective. This is like one of the common things that I get all the time. Parents are always like, oh, my child has a tantrum. Every time we go to the store, it's like, they fall apart and it's the end of the world. Well, let's stop for a second and look at the situation and go, is this in the child's zone of proximal development? Because when you take a child to the store, they go and they're like, ooh, look at all of these cool shiny things that are like, I want you to want me. And they're like, yeah, I do want you. You're cool and shiny and you bounce right and you got this cool color. Like, I want to take you home. And the store's like, most definitely you want to take me home, right? And then all of a sudden you come along and you're like, nah, it's not happening. And like, right, this is the hard part, because if we look at it from the perspective of a child, they don't get what money is yet, right? How many 4-year-olds understand what salary and wages are? Like, no one, right? If you do have a 4-year-old that understands salary and wages, I would love to meet them. But right, kids just don't get money and what it is. They just get that it's green stuff that you hand over, or a card, and swipe it, and then you get things. And then on top of it, we also have to remember that when kids go to the store, they see what we do. And this is where I love it, because this is the question. And if you are one of my families that I've worked with, you've probably heard me say this. When was the last time you went to the store and ended up leaving with stuff that you didn't plan on buying? And everybody's like, yesterday, right? So the question here is, who controls the wallet? And it's like, oh, yeah, I do. But they just see that I control the wallet. They don't get that money's not infinite. They don't get that the store's trying to get them to buy stuff. They don't get that I need to get groceries and get out of here and get dinner ready. And they don't get that I had a long day at work and I'm going to buy that magazine and lip gloss because it's going to make me feel better, right? Well, they're juggling all the same things. So it's really hard. And that's why we have to stop and look at it from their perspective. And, maybe the solution to this is like, maybe going to the store on a school night when I had a long day at work and they had a long day at school is just probably not the right opportunity. But we can practice it on other days and other times, right? And those are the days where we can go like, you know what, honey, we're going to go to the store today and we're going to look, but we're going to leave empty-handed. And because we have our buckets better filled and we're not running on empty, right? You've got your coffee or your matcha. Today's presentation is brought to you by Green Tea. Right, with you, you can be a little bit more present and available to help them. But I'm not saying that any parent has to be present and available to do all the things all the time, right? Business mode and teaching mode are hard. And you know what? We can teach kids, but we also got to get dinner on the table. So give yourself permission to think about, okay, what does this look like for them? And where will it be optimal for me to meet you where you are? So we can take their perspective and we can build on it. We can make opportunities to grow together. And we can remember that play can be random and not structured. The fancy term for that is incidental play. And, for all of you who watch Bluey, there's a lot of incidental play there going on and a lot of learning opportunities that can happen there. But play can also be a great way to explore hypothetical situations like I talked about, role play, So like if something is going to be going on, something new like moving or going on an airplane for the first time, let's role play and talk about that. Let's pretend to see what it would be like. Let's read stories about what that would be like, because it's a great way to explore what those new and unfamiliar situations can be like. And then all of a sudden your child feels armed and prepared to do it. Now, I've not talked a lot on technology here because we could fill multiple hours on thinking about how tech affects kids with resilience. I just want to highlight it's not all bad. Technology is not about how much you consume, it's more about the quality of consumption, meaning you are what you eat. So I always like to tell parents and kids, like, you know, if you eat salad all day, every day, okay. But if you eat French fries and hamburgers all day, every day, is that as healthy? And, you know, the kids are like, no. How do we recognize what's healthy versus unhealthy media? How do we pay attention to which kids are more vulnerable and susceptible to the influences of media and screen time, and which kids are like, okay, I'm chill, I'm cool? And also, how do we use media and screen time as a tool to promote the real thing, which is developing those safe, stable, nurturing relationships where we can do stuff together? Because, right, how fun is it when you can get your teen or, like, you know, school age kid to appreciate stuff together? Right? This is where you can do fun things. Like, you know, some of the kids are like, what's that thing that's round and like music comes from it? And you're like, oh, a record. And then they ask the novel question of like, but how do you know what song it is? And you're like, honey, let me teach you how you count the rings on a record and you put the little needle down, right? Or, you know, you can share music or explore things together. And that's such a fun thing because that develops that relationship together. So bringing stuff to a close, in putting all this together, this all starts with and applies to you as the parent, as the caregiver. All the things that we've talked about, check in with yourself, right? We have to be available and present to be helpful, to provide that stable, safe, nurturing relationship. It's okay if you need a moment. It's okay if you need a breather. You're human. We're all here. We're all trying this together. Be patient with your child. Be patient with yourself. Good enough is good enough. There is no such thing as the perfect parent. There is no such thing as the perfect child. If any of you are the perfect parent or child, again, they know how to contact me at the State Board of Education. Please reach out because I'd love to meet you. But I've been doing this for a while and I've yet to meet the perfect parent or perfect child. It's okay. Most of you are working really hard and trying, and there is no try. You're doing already. So just give yourself that kindness that good enough is there. Look for growth opportunities. This is the hardest part. We are all tired, but what I like to call that teaching mode, we do need to do a little bit. Because, like, you know, if we don't want our child to develop a tantrum at the store, we can just never take them to the store. But if we don't provide them with that growth opportunity, then they're never going to learn how to walk in and deal with pressure and say no to that pressure, right? So how do we help kids do that? Look for those growth opportunities. Maybe schedule a trip to the store on the weekend where you're like, hey, we're going to look but not touch, and we're not going to take home, or we're going to put that on your wish list. Or better yet, why don't we go looking for a birthday gift or a holiday gift for so-and-so, and then we're training pro-social skills. Or we can schedule play. You know, if you want to throw on an episode of Bluey or another show like Daniel Tiger and you want to talk about what are the lessons, how do we reenact it? How do you watch something like a piece of news or a movie with your school age child or teen and talk about it? That's a cool growth opportunity. How do you talk about like the rough day your kid had at school? Because guess what? School's just as hard as your work day is, because that is their work. They just don't get paid for it. So let's talk and process those growth opportunities together. It's also really important to know your child and know yourself, because this also applies to us. Who is your secure, safe, stable, nurturing relationship that's helping fuel you? Is it your spouse? Is it your partner? Are there other people on your team or in your village that help you with your child? Maybe it's your child's teacher. Maybe it's a social worker. Maybe it's a medical care provider like me. Maybe it's your neighbor, or maybe it's your aunt or uncle. But who is your person? Because they're just as valuable to you. This is where I always invite parents. You need to make sure that you have your own oxygen mask on first before we can get to kids. It's really important that we take care of ourselves so that we can take care of them next. And finally, we can't forget, this is the hard part about adulting, is sometimes we forget about the power of play. Play is learning. And guess what? Play is so fun and therapeutic, right? That's why we love things like dance parties or improv or just getting silly, because sometimes when we explore and we bring that sense of curiosity, in order to do that, we have to have a sense and an environment of safety. And how cool is that, where we can mess around and goof around and be ourselves, right? And do things. That's so fun. That's so protective. It's helpful for you. It's helpful for your child. And take their perspective. You know, it's really been a minute since we were kids. So again, don't gaslight them for their feelings. Your toddler who's feeling frustrated over not getting what they want, that's a valid frustration for them. Let's acknowledge it and help them through it. Not blame them for it, because they just don't know better yet. And be the gold, right? Be the person here that helps your child come back together through all of this. So we're going to move on to questions, but I really want to say thank you. If you want, we have this QR code here that links to an article that we put together on our blog through Connecticut Children's that talks about growing resilient and how to get through tough times. So that's there for you. I will leave it up for a few more seconds, but other than that, thank you for your time and taking this journey with me. I'm open to your questions.
Wow, Dr. Ketter, thank you so much. So before I get into a couple questions, we have a couple good ones that have come up. I just want to thank you real quick. As a social worker and as a mom, there's takeaway lessons for me. So I know there was takeaway lessons for the participants. I do somewhat wish this was a house call because there's a dinner routine going awry upstairs and I could maybe use some of this in the moment. But thank you again so much. So let's get to a couple of the questions. The first one that came in, and I can totally relate in the moment, is I know routines are really good for children, but what happens when kids don't like the routine? Weekly therapy is a routine, not a surprise, and even bedtime is, but I get the same pushback. Any suggestions?
Awesome. So kids are trying to struggle with routines and a whole other topic that we did not talk about tonight, which is autonomy. Kids want to learn to do what we do, which is be the master of ourself and our own destiny. And again, that is great as an adult who's paving a way, who has a skill set. But right now, as that young kid or toddler or school age kid, it's like, well, love, you're not paying the rent yet. And I know you love your Game Boy phone, Nintendo Switch, but somebody had to pay for that. So we're working through it all together. You know, it's hard to juggle, but the reality is all human behavior is what we call transactional. Everything is based on what is my motivation and what's going to help me get to what I want. So you might hear that Latin saying quid pro quo. Even kids are very quid pro quo. So how do we make them do the thing? Well, I hate that parents use the word, so I like to take the word bribe and go, because for all of you that work, I would like to ask, would you call your salary a bribe? Like, do you just show up to work out of the kindness of your heart? Or is there the extra bonus of maybe you get a paycheck? And that's great. The problem is this is work for kids. Going to therapy is work, right? That's mental work. Just like if you were going to physical therapy, that's physical work. Or if you're going to math tutoring, that's cognitive work. So all of those are things. So that's not easy for kids. How do we make it worth it for them? Which means we recognize that they're doing something hard. So we're not spoiling them. We're not bribing them. We're reinforcing the fact that they're stepping up and trying something hard. So that's why I emphasize that we pay kids not in paychecks, unless you have a child who is motivated by dollar bills or coins or something like that. But it could be a little bit of extra screen time. It could be that we go out for pizza parties on the weekend. It could be that we get some extra cuddle time, or bedtime's delayed an extra 30 minutes, because we want to pick and choose and acknowledge that the child is working hard, and we want to reinforce the fact that they are stepping up to work hard, because that is the single most important skill that any child can develop. The ability to go, you know what, I'm working hard and I can do this. Self-efficacy.
I'm going to second. I think language is really important. And when I do work sometimes with schools, I'll use the language of reinforcement or acknowledgement instead of reward, because I think it really is that theory of reinforcing students, or for kiddos, your own kiddos at home, for doing that hard work. So thank you so much. A couple other have come in. So there was a great question about what can we do for parents who have experienced their own toxic stress? And this might impact their child's ability to build some of this resilience. So how can parents best support their child when they might themselves be struggling?
So that is a great question. Thank you for asking that. This is where I'm going to acknowledge and throw in a movie reference. As identifying a second generation Cuban American, I love that Disney gave us the film Encanto and it gave us the song We Don't Talk About Bruno, because what that means for me it is a metaphor for how we have stigma around things like trauma and behavioral health. And the problem is when we don't talk about Bruno, Tio Bruno ends up hiding in the attic and making friends with rats. And then when we don't address that for a while, it gets really challenging. So instead, it's really important to give yourself permission to acknowledge that trauma is not your choice. It's something that globs onto all of us. All of us have varying degrees of trauma histories. And we could do a whole other session on trauma-informed care, meaning how do we approach kids and teachers and adults with a trauma-informed framework. Most important is giving yourself that sense of kindness that you deserve, which is that you are not your trauma. But if you are looking for help, there are cool evidence-based tools, things like trauma-focused cognitive behavioral therapy, and there are different types of parent-child psychotherapy and other tools that can help reconnect those relationships with you and your child in the face of trauma. If you are wondering about any one of those, I invite you to talk with your child's pediatrician, nurse practitioner, or family physician to explore what opportunities there are.
Thank you. I think you did a great job tonight by using lots of examples from little ones all the way up to our teenagers. This is a question about a teenager. So with a teenager, sometimes they feel like they don't want to talk about school and they might seem like they don't even want to hear their own parents' voice. So do you have any suggestions on ways to be patient and flexible and support those maybe more challenging teenagers?
Oh, teenagers are fun and they are a hot kettle of emotions and hormones. And we were all there, like, right? Like it was such a rough time that most of us are just like, nope, we're gonna just blank that out and not remember it. For those of you, again, I'm gonna bring up a movie reference. If you have not seen Inside Out 2, a great way to think about what do new emotions look like, especially as we get to teens, because we start thinking about things like anxiety and boredom and self-esteem and embarrassment and all of those things. Um, teens might seem that they don't want you around, but if you have that secure relationship, it's worth its weight in gold. For those of us that are old enough that before we started calling them dad jokes, they were just like bad jokes, right? If you make a bad joke and your kid rolls their eyes, that's a point. In improv, we're like, ding, that counts just as much as a laugh because they're like, ugh. But at the same time, they know that you're doing it to be there for them. So what's hard is we have to change our behavior to get the desired relationship. Each kid is different. Some kids are going to be like, I just came home from school today and you won't believe what Sally said. And there's all this drama going on in band class and everything else. And it's just like explosive. And you're like, I'm an introvert. How do I have such an extroverted child? I just can't. And you're just like, uh-huh, uh-huh, uh-huh. But you're there, you're present, you're managing that relationship. On the flip side, you might have a child who's more of an introvert. And you're like, honey, how was it? Okay. Anything you want to talk about? Okay. Any cool music or something new? You're like, okay. But if you keep offering those opportunities, it gives them that chance to know that you're there for them. And it's going to come back to you when they need you. This is also really important where we talk about that relationship. There was this thing called the X plan that was really popular with teens. So for any parent that has a kid with a phone, I always say the rule is, parent, are you okay if your child texts you because they feel unsafe, that you will come get them, no questions asked, no punishment, no yelling? And all the parents are like, ugh. Because right when your child says I'm not safe, you're like, protective mama, papa bear, what's going on? But you need to help suppress that, because what's most important is that child just said, I value you so much that I need a rescue right now, and I recognize that I made a wrong choice, and I'm coming to you knowing that. Can you come get me? Yes, every time. We'll talk about it tomorrow. Thank you, honey, for calling. So we want to just keep those times and opportunities together because that's important.
Awesome. I'm going to end with maybe a specific kind of question, and I appreciate all the insight you've offered. So what happens with so not all children copy behaviors, but we know some kiddos do. So some specific questions around children who copy others' behaviors and picky eaters. So any kind of tidbits or nuggets of advice. I don't want to let folks off without answering their questions. So we don't expect you to have a full answer, but any kind of suggestions would be great.
Awesome. So, two things to kind of think about: copying behaviors versus picky foods. Picky foods is a whole like, is this in my zone of I'm trying it yet? Because I like safe things that I'm cool and familiar with. How do we expand that over time? There are all these cool things like food chaining, but we have to remember that even toddlers, sometimes you have to show them a brand new food 20 times before they're even willing to touch it. And that's a typically developing toddler. So remember, whenever we're trying to expand a child's skills and abilities, we want to use invitation, not force. We want to invite them to try by creating that safe, playful environment. So sometimes a great way to help build your child's diet is by playing with food and helping invite them to cook the food and pick out the food and do things like that. Now, when it comes to copying other behaviors, that's where we can get into the category of mindfulness and how do we process what's going on with our kids. Because say maybe a child repeats something like, what the Sigma? Like, and you're like, honey, what does that mean? And they're like, I actually don't know. Okay, honey, this is a great moment. I have no idea what that means. Could it be something mean or hurtful? I don't know. But we're inviting that conversation to think about, what is it? And that's where we draw mindfulness to how do we help kids not just go on autopilot or copy something because they might think it's funny, right? We were all there where we try to say something to be cool because someone else said it, but we don't know what it means. And how do we create that safety net for them to explore what that could be, again, without the threat of punishment, but to explore that with them.
Thank you so much for taking the time to chat with us tonight, for sharing all of your wisdom, your kid-friendly, family-friendly way of sharing information. I am so happy that I get to know you and work with you. So thank you, Dr. Ketter. I see lots of hearts and claps. We are going to end with kind of some closing content, but please take a moment to thank Dr. Ketter in the chat. See all the love, and thank you again. So as Cirque puts up our closing slide, I am going to end with just a couple kind of quick announcements. So again, thank you all so much for spending some time of your evening with us. We appreciate all those who attended, interpreted, and presented. We hope you found this useful and consider registering for the 2 upcoming webinars that you see here on the screen. We also hope that you tell a friend or a family member and that they join us too. Please give us some time, but this webinar will be posted on the CSDE website in multiple languages. So again, thank you, and please have a restful evening.